Hi everyone, this is Dr. Holly with Queen City Health Center, and as you can tell, I'm expecting. If you're watching this video, congratulations, you might be expecting as well, or plan on getting pregnant sometime in the near future. And we have collectively created some videos to help you and help anyone that's pregnant to position the baby in a comfortable place so that birth and pregnancy is positive and not painful, and give you the best opportunity for the best birth possible, as well as feeling the best throughout your pregnancy. This video is about resting smart and also putting your pelvis in the right position when you sit, because there's so many things that you can do that are actually detrimental to positioning for baby, and that's most specifically how you sit. So I'm going to teach you when you're pregnant and when you start to have a little belly like this. So cute. I think I'm 27 weeks, but anywhere along that second to third trimester, it's going to be important to be sitting properly. So I've got a ball on this chair, because if I sit on this chair, it is actually, this is about right for me, but almost too low, because you want your knees to be at 90 degrees, but you can see how these will flex a little bit further. So if this chair was any lower, that would be moving the pelvis back and pushing the baby backwards and closing my hips off and constraining the baby. So if you have a sitting job and you're sitting in this comfy chair and relaxing back for long periods of time when you're pregnant, that actually is going to elongate your birthing process and put the baby in the wrong position, and potentially could lead to a C-section later. Doing these exercises and changing how you sit can absolutely change the outcome of your birth. So you want to be at 90 degrees or higher. So I like the ball. And if you have a desk job, you certainly can get one of these balls to sit on, so or higher. So you can see now, if I were to put a pole along my femur here, you can see that it's pointing down, not pointing up. So if it was pointing up, that would be the wrong position. Next, super important that if you had poles on your femurs, that you're pointing out. So you want your pelvis to open up, not to close down. So I know that you've been taught as a woman to cross your legs or keep your knees closed, but if you're pregnant, you want that baby to come out. So let's keep them open. So you want your knees pointing out. Now, if you're on a ball, so you could do this on a stability ball in terms of exercising and strengthening this pelvic girdle and putting the baby in the right position. Same position sitting or one of these wobble cushions. You're going to rock back and forth. So bringing the pelvis forward, opening up, arching your back. You can even take your neck into extension and pull your shoulders open to get a full range of motion and stretch there. And then almost like the cat-cow move, you can reference our cat-cow move that I taught earlier, but rolling your shoulders in and bringing the baby back. You can see that my feet come up a little bit, and that's okay. You don't have to keep them on the floor, because I'm just trying to keep the space open and not put pressure on the baby. So we're going to move pelvic tilts forward and back, and I would recommend doing these daily. 1, they feel good. 2, they're good for your spine. 3, they're good for your baby. And 4, they're going to be great to put you in a good position for labor. So back and forth 10 times. Hips are open. We've got greater than 90-degree angle on our knees. The second exercise that you can also do on either a stability ball, making sure that the height of it is correct, or on one of these wobble cushions, is left to right. So you're going to contract on one side and take your whole head, neck to the right side and then to the left. Again, these stretches should feel really good, because those muscles that are holding your abdomen in the right place and holding that little basketball baby are contracted and so tight. This is just going to stretch the muscles as well as the fascial layer that holds the baby in place. So 10 of these on each side. If you want to count out to 20, once a day is going to be most effective. If for any reason those are uncomfortable or you experience pain throughout any of those exercises, discontinue. Certainly leave and comment below or ask a question if you have any. But good luck. Make sure if you have a desk job, definitely change the position of everything, because I want you to have the healthiest, happiest birth and pregnancy possible.
Hey guys, thanks so much for watching this video. If you want to connect with us and learn more, we're constantly shooting information or shooting videos. We actually have a blog as well, and we have a website where you can learn so much more. If you want help with your health, you can actually connect with us, come into our clinic, or jump on a phone call with us and see if we can help you. To do that, go to the links below in the information area and click those areas, and then you can move forward and see how we can actually address and help you with your health issues as well.